You're covering it. You're covering the...
I don't know what that's for.
Today we're going to talk about mental illness and how it affects those suffering from it in the United States. Mental illness is a common diagnosis in the United States. The burden of the illness affects many people. As a daughter of a psych nurse, I've been raised around mental illness all my life. I also am a nurse for 15 years and I have a human services degree, so I've had a lot of interaction with mental illness. Today I'd like to talk to you about mental illness and the effects of serious mental illness that it can cause in a person's life. I would also like to inform you of the newest placement available for those who meet the criteria in Southwest Iowa. Let's start by discussing what serious mental illness is and the diagnosis guidelines. Serious mental illness in adults means an individual over the ages of 18 who meet the following criteria. There is a DSM-4 out that is has the guidelines for the different diagnoses people have, and it currently encompasses the behavior and the emotional disorders and the duration that they suffer from these to decide how to classify them. Most people with mental illness have to have at least 2 of modern impairments, and they have to have lasted at least a year, or reoccurring hospitalizations. Severe impairment can include one of the following or many of the following, such as feeling, mood, and affect. Basically, that's uncontrolled emotion, which is clearly disruptive in its daily life and the aspects of the person's life and the person that they're around. Their thinking is severely impaired in concentration, persistence, and pace. It affects families, the disruption of family relationships. The family does not function as a unit, and they experience frequent turbulence. The interpersonal skills are affected. They have severe inability to establish or maintain personal and social support system. They lack close friends. They usually burn their bridges. Role performance encompasses the frequent disruption of role performances in individuals, and they're unable to meet the normal expectations that you and I meet in our daily lives. The social and legal aspect is very common with someone suffering from mental illness. They have the inability to maintain normal conduct and follow normal guidelines as prescribed by the laws, rules, or strong morals. Usually, someone who suffers from mental illness has run-ins with the law. Their self-care and their basic needs are most definitely affected. They have the inability to provide things such as shelter, food, clothing, hygiene, transportation, their medicine. They usually need assistance obtaining housing, food, with their diet, their getting their medicine, taking their medicine, and staying compliant. Let's start by discussing the population of people suffering from serious mental illness. Mental illness is more common than cancer, diabetes, and heart disease. 1 in every 4 people suffer from mental illness. That's 25% of individuals develops 1 or more mental illnesses during at least one stage of their life. 45 million people globally suffer from mental disorders. 154 million people suffer from depression. 25 million from schizophrenia. 91 million from alcohol. And 15 from drug abuse. Many people suffer from more than one mental illness at a time. And a lot of times they begin to self-medicate. Mental illness can lead to serious life-altering behaviors and even premature death and suicide. People with serious mental illness need a strong support system. They need good providers. They need mental health providers. And they need family and a program support. Mental disorders can be diagnosed and reliably and accurately these days. Treatment works. Yes, as many as 2/3 of all people diagnosed with mental disorders do not seek treatment, whether it's for fear of being stigmatized, fear that the treatment won't work, or the fear that the treatment is worse than the illness, lack of awareness, funding, or accessibility. Mental illness is a serious public health challenge that is under-recognized as a public burden. The toll of the mental illness is tragic. The human cost that it weighs on the person suffering and their family, it can be deadly. Suicide claims a life every 30 seconds. According to the World Health Organization, 3,000 people commit suicide every single day in the world. For every person that succeeds in taking their own life, there are 20 more who have tried. The global suicide rate is up 60% over the last 50 years, with even more marked increase in the developed countries. Suicide is among the top 3 causes of death among people between the ages of 15 and 34. But most suicide victims are found among the elderly, those aged 60 and above. Suicide causes more death every year than homicide or war. Suicide is a huge, largely preventable public health problem, causing almost half of all violent deaths, resulting in almost 1 million fatalities a year. Estimated suggested fatalities could rise to 1.5 million by 2020. 90% of all suicides, mental illness is the attributing case. The economic cost with mental illness costs billions of dollars. There's no cost to put on what it does to a person's life and their family life. The economic costs of mental illness have been studied, and the figures are staggering. $1.5 billion a year is done for treatment in the United States for the cost of social service, disability payments made to patients, and for the lost productivity and premature mortality. The social costs that affect mental illness can lead to unemployment, homelessness, incarceration, and poverty. The lack of these things can be a burden on not only the person, but the family, society. In America, fewer than 55,000 Americans currently receive treatment in psychiatric hospitals. Meanwhile, almost 10 times that number, nearly 500,000 people, mentally ill men and women, are serving time in U.S. jails and prison. An alarming 65% of boys and 75% of girls in juvenile detention have at least one psychiatric diagnosis. Approximately 40% of all people who are homeless in America suffer from serious, persistent mental illness. Many of these individuals also suffer from reoccurring substance abuse disorders. Basically, they self-medicate to get away from their mental illness, which then causes another problem. The newest trend in Southwest Iowa is community-based living, also known as a group home. There will be a new group home implemented in Southwest Iowa by the end of 2011 called Anchor Homes. Anchor Homes will adhere to the rules and guidelines set up by the Department of Inspection and Appeals, the Iowa Medicaid Enterprise, CMS, the State Fire Marshal, and the local governing bodies. It will be a 3 to 5 bed home with a 6 bed for respite care. Chemical dependency, developmentally delayed, traumatic brain injury will be the clients that they will serve. The mission at Anchor Homes is to assist area community residents with the symptoms of mental illness in achieving and maintaining their highest level of functioning in a home-like setting. They will be able to live near their families and still have supervised and managed support for their symptoms. The programs will include and address things such as budgeting, hygiene, social skills, goal setting, medication compliance, symptom management, and daily living skills on a daily basis. The activities they will encompass will be needlework, gardening, local community activities, bird watching, fishing, and woodworking, and many more. The owners of Anchor Homes are professionals in the healthcare field. They have career goals that have led them to the decision to take an initiative to reach out to those suffering from mental illness. Today we have been able to hear about the startling facts of serious mental illness, and one new resource available in Southwest Iowa. Mental illness does not discriminate, and none of us knows when it may affect ourselves, our mother, our father, our brother, our sister, or even one of our children. The startling statistics of suicide associated with mental illness is a big eye-opener. And finally, a resource in Southwest Iowa called Anchor Homes, that a place in our community that can house those who suffer with serious mental illness in a living environment where their disease process can be monitored, managed for their safety and the safety of the community.